We're the only ambient company that can give direct-to-patient stuff, and that's where we're firmly in that space right now. We're excited. It came from a good place. It came from trying to do right for the patient, not necessarily for the provider. It came from the idea that patients, don't remember what they're told and struggle with that, and that's not what Ambient's about. Ambient's primarily improve the EMR experience for physicians. We're the leaders in that and continue to be.
Dr. David Langer, thank you so much for hopping on today's podcast with us today. For the audience listening, we have the founder, CMO of Playback Health, and Dr. David Langer is also the chair of neurosurgery at Lennox Hill Hospital, which is part of Northwell Health on the East Coast, for those that haven't heard of the hospital. So first, Dr. Langer, you started Playback by recording videos on your iPod for patients. What made you confident video would be the key to improving care communication?
Actually, I was using QuickTime on my Apple desktop machine in my office in 2008. Around 2007, Apple had you could run Windows operating system on Apple through a separate, I can't remember the name of the software, but it was, you could run it. But then when Apple switched their chip from the Motorola chip to, I think, to an Intel chip or some other chip, I'm not a hardware expert, it allowed you to run the emulation software on the OS, on OS, so you could run essentially Windows. And the reason why that was important is I could have a single Apple machine in my office in healthcare. There were no Apple machines. There's still very few Apple machines in healthcare or in the patient space. But I could run all the legacy, PACS imaging, and it wasn't EMR yet, but there was some early EMR on my Apple computer. And QuickTime worked a lot better on Apple device than it did on Windows. And QuickTime, as you know, has a screen recording feature. So if I would go over an image with my patient, I would just do screen recordings and I'd burn them a CD. So if you came in with your MRI, I'd plug the CD the MRI into my machine, and then I'd display it on my Mac, and then I'd review it in front of the patient with my words and my mouse and describing what I was seeing, and then burn them a CD and give it back to them as part of their office visit. That usually would take about 15 minutes for the thing to burn, and it was a mashup. And we then, my partner and I, Ken Cork at the time, who this was way pre-Playback, but Ken came from Apple, and I'd hired him to work with me in my office per diem after having him trick out my apartment with Apple stuff when my kids were born. And Ken and I found this program on an Apple server called Podcast Producer. And Podcast Producer allowed you to it was sort of templated podcasts. You know how you have templates on iMovie, or even today we see this in a lot of the mobile software. You would create a template, with the logo or have a place for date or whatever, just some graphic. And instead of burning a CD, you'd create the server. We'd actually install the server in our data center and create little tiny URLs that we'd email to patients, and they could download the video from our server, which really was a lot easier than burning a CD and a lot less intensive. And that was how we had it originally. The idea came from, watching my kids do their homework. They went to private schools in Manhattan and had all the stops at every bell and whistle, and yet they were just using their Apple machines to screen share and text and FaceTime and all this kind of stuff. And I'm like, why can't we use this in healthcare? It's insane. And that was sort of, to this day, we're with Teams now, we're finally up to speed on doing video conferencing and telehealth. But, even today I'm doing things with the radiologists, having them review my films while I'm with the patient. I don't think a lot of people even thought of, which we were thinking way back then. That was already, 14, 15 years ago. It morphed in, and then I got recruited to go to Northwell in 2010. I brought Ken with me. Basically, we hired him full time, and we installed our own server in the data center, which was very intensive, especially in large healthcare companies. Convinced the health system to invest in me. The idea of creating videos for patients was very compelling. But the best use case are discharge instructions, or the first office visit when you tell them what you're going to do surgically, because people always forget that stuff. And we built a company on that idea of creating video discharge instructions and video office visits. The problem is that, the Podcast Producer got turned off. We ended up having to, there's no way you could put Apple servers into healthcare. So I raised some dough, and by 2014 hired a consultancy to build a sort of a web version of the same thing on the hospital data center. And we built a pretty decent version that I used, for a couple of years on patients for about 2015 and 2017. Then the whole thing crashed and burned because I ran out of the security certificates and all this other craziness, and was sort of dead in the water for about 6 months. And the idea is a good one. I think the biggest problem is that patient-facing tech like that, there's no money for it. And a lot of healthcare systems, while they like the idea, they pay lip service to what's beneficial for patients. All they really care about is getting people in the door and operating on them. And it's just the business of healthcare. There's no money for education. There's no money for, they say patient experience, but they don't want to spend money on patient experience. And certainly, Northwell is one of those companies. They talk about it, but there's no budget for it. And so you have to develop your own, they measure you on it. So they're leaving up to the doctors to figure out how to create improved patient experience, Prescaney scores and all this, and HCAP scores. And so you really have to work on your teams and your culture. But when it comes to tech, no one's spending money on the front end tech. And the budgets on these healthcare systems run into the hundreds of millions of dollars, if not more, just on the IT side, as you know. And yet a minor fraction was spent anywhere close to anything patient facing. So in that environment, Greg was my co-founder, was coming out of a hedge fund, was kind of had a tail and was kind of interested in what I was doing. I'd been talking to him about it for years. And in 2018, we founded Playback Health. Greg wanted to give it a shot to see if we could, raise money and build a company. And that's what we did. So from about 2018 to 2023, we're squarely in this video discharge instruction space. I became enterprise in Northwell in 2022, sort of after COVID, 2023. But you'd be surprised, even though this was a fantastic tool for me, I can't imagine not having, I run my entire practice off of this. Video is a great way to store data. Instead of looking at packs, I have like highlight reels of every patient visit, so I can quickly go back and look at the important films at a fraction of the memory of packs. But, it's a workflow issue. There's an integration issue. A lot of docs just don't, they need it really easy. They don't really think it through. People aren't as creative as you think. They're sort of driven by some incentives and some reverse incentives that, don't make this necessarily critical to your financial success. And I'm different. I'm always trying to solve problems, and sometimes at my own detriment, to be honest. But what changed in March of 23 was ChatGPT. We had all these videos and audio files collected over, for 5 years. And we're easily able to feed a large language model and create our own version of Ambient. And we were probably a month too late. Ambient became a massive thing in sort of end of 23 and 24. And a bridge really became sort of the darling of Epic. I wasn't an Epic shop, which is part of the problem, but I was even at Epic talking about this Ambient world probably in April of 23 to give you an idea of how rapidly things have changed. But Bridge was in this business to start. They actually had created their own LLM, and were in this note space before Chat came out, and they were well positioned to take advantage of this shift. But we built a really, really beautiful and useful ambient solution for office visits for doctors and their patients that I use exclusively now for the last couple of years. I haven't written a note regarding a patient in the EMR for 2 years. But we also have a huge patient-facing piece, which our competitors don't have. And until now, that value of that is unrealized. I think that I know there's value to because I see the reaction my patients get. But I do think that eventually video and this kind of patient-facing stuff will take off. It's really useful to providers. It's useful to patients. It's great for Ambient. You can create very robust, specific, boutique, personalized healthcare and piece of information that are purely about the patient and their problem, and deliver it mobile to mobile, web to web, web to mobile, any way you want. And so we are, certainly not one of the biggest ambient companies, but we're the only ambient company that can give direct to patient stuff. And that's where we're firmly in that space right now. We're excited. It came from a good place. It came from trying to do right for the patient, not necessarily for the provider. It came from the idea that patients, don't remember what they're told and struggle with that. And, that's not what Ambient's about. Ambient's primarily improve the EMR experience for physicians. We do that, but we also, do something I think really unique for patients that I think we're the leaders in that and continue to be.
Yeah, that's well said. I mean, I'm just impressed by the background of how this came to be, from burning CDs all the way to videos that you were providing your own patients, to then realize, like, wait a second, we can, with the advent of AI, take this to the next level with ambient listening, and that's what makes you guys unique, I think, because like there's a lot of ambient listening solutions in the market, but you guys have come at it from an angle of like, we've done the patient education, we've done the videos for discharge. Now it's that plus this ambient listening. So I'm sure you're able to not just train your LLMs on a bunch of good data, but do more with that. And like you said, it's very direct to patient in that regard.
Yeah, we've always been an ambient company. This hasn't been an ambient AI company until chat came out, because we were ambient because you recorded the conversations, transcribing it with Whisper, and then we basically have the transcription, but we weren't doing anything with it because we were thinking more videos and audios. But once chat came out, we were able to convert those transcriptions into notes, and so it's exciting. I mean, I've never been. It's very, very exciting what's going on with AI. Obviously, AI is very bad. People use this, they're just going crazy over, this kind of, some of it's the perception of the impact and the real impact, but this is happening now. I mean, it's happening really quickly, really fast, and the results are just breathtaking. It's very energizing, exciting to see how rapidly healthcare is taking this stuff as opposed to tech in the past.
Right.
And it's really disruptive. It's amazing.
Yeah, no, I completely agree. And you're someone that's bought into yourself into this tech. Like, what are some of the biggest gaps with like how other providers share, or challenges with those providers and how they share information with patients, right? And how do you guys help them approach that differently at Playback?
First of all, physicians in general don't feel it's their responsibility to provide anything. This is the responsibility of the hospitals, and the hospitals don't really understand the problem. The discharge, its process itself has been just under-engineered. It's just no one cared about it. And honestly, the only reason why anybody cares about discharge now is the readmission rates are measurables and length of stay is measurable. So, but good discharge instructions ultimately don't really solve all that problem anyway. But patients are left hanging. Oftentimes the person who's giving your discharge instructions is the nurse on call that day, or in that
Right.
it doesn't even know anything about it. They reading some piece of paper. And so there's a deliverable that's given every patient, printed out of the EMR to your discharge instructions. It could be 28 pages of gras doux and only like actually 2 lines mean anything.
Right.
And most of it's just what the government requires to put in there. It's all kind of legalese and covering your butt to make sure you give the patient what they need so you don't get sued.
Yeah.
And so that's sort of the nature of discharge. And I think that ultimately video serves itself really well in those situations because, especially if the caregiver who's taking care of you isn't there, or didn't hear everything. Very often the discharge process, people just want to rush out of the hospital, and the last thing they want to do is start thinking, and they just want to get out of there, and just give me my instructions so I can go. And so by recording it and memorializing it, you create a document, a digital document that's transportable, shareable, and quite more useful than some crappy piece of paper. So that's, I think, one of the best use cases. But you can imagine any recordings, pre-operative instructions, post-operative instructions, bedside conversations, end-of-life conversations, anything in the patient care space that has value can be recorded. And then, not to mention the fact that when I make the recordings for my patients, especially pre-op, going over the plan, my whole care team can watch the video like one-to-many. So I don't have to keep repeating myself what my plan is to anesthesia, or my resident, or my fellow, or my nurse. And they understand, our residents love it because they see what my impression is, and they learn how to read films because I'm sort of going over with the patient what I'm seeing. And so there's huge value to video. It's just education and this kind of patient experience stuff doesn't pay the rent, and it becomes a relative cost. The benefits are diffuse, and the trouble with healthcare is that if you improve these sort of secondary things like patient experience and length of stay and readmission, while it's valuable, it's hard to measure the financial impact on that stuff directly related to this. Yet somebody has to write the check for it. And so that's the inherent rub. Healthcare is very poorly organized in its way of thinking about tech, because the bottom line is that the things they're focused on are the things that make money. So there's tons of AI tech in revenue cycle and in the billing side, and there's a lot of focus on that. And yet this kind of other area that has probably much more a greater impact on what's your patient. There's a laggard, and we're hoping that changes. And the chat piece and the AI piece gives us, a foothold in the ambient space. So when you go into a customer, you say, listen, we offer state-of-the-art ambient for your notes. We also offer this patient-facing piece that we think is really exemplary and unique. And so it just depends whether healthcare companies, want to take advantage of that.
Right, right. Everyone knows that patient education is important, but how many of those actually invest in it, and create?
Yeah.
Yeah.
The problem is Epic is Epic, they have to go through Epic. Epic does none of this, but they do provide a discharge instruction, piece of paper in the digital form.
Yeah.
There's an element of, it doesn't do nearly what we do, but it doesn't matter. The hospitals don't want to have another form of EMR. And so
Yeah.
Epic really is difficult. Even if you integrate an Epic, you have to understand that there's reluctance on these healthcare systems to
Yep.
kind of ruin the brand. And
Right.
my chart is hegemonic with Epic. So,
Yep.
these are the major problems and the friction points for this patient-facing stuff.
Yeah, I hear you. Yeah, my own father had a procedure done last year in an ambulatory surgery center at an Epic House, and he said he got the piece of paper like you said, that had a few lines circled there or highlighted, I think it was, and that was it.
Yeah, it's
Those are
terrible.
just-
25 pages of stuff, and 90% has nothing to do with, it's just.
And
a
you
bunch
want to
of
hear
gobbledygook.
if you're able to.
Oh, we have the data. We showed movement on patient experience. We showed movement on HCAP scores, significant movement. But the truth is that there's always a caveat. Well, can't tell me it's all due to playback or blah blah blah. Well, part of it affects culture because when people have a great tool, they use the tool better, and then they are happier. And so we have our culture of our department is really unique.
Right.
And so. And that, I'm the founder, so they think there's bias because I'm, pushing it, which is partially true. But there's always an excuse not to use stuff. And one of the most difficult things for me, to be quite honest, is I've worked so hard, so tirelessly for this, for all the right reasons. And after a while, when you keep hearing the same crap over and over again for the same people who don't have the experience that I do and don't have the motivation I do, but yet are the decision makers in hospitals for different reasons, that's their right. If they can't afford it, that's the way it goes. And it's frustrating, to say the least.
Yeah. Yeah. And on that point, I know, taking a step outside of your own practice and the work, you've been able to do in your practice, and clearly they bought in there. What types of other practices or care teams benefit the most from this platform you guys have put together? Because you've put ambient listening, you've put patient discharge education together, right? So what type of practices or care teams benefit the most from that, especially outside these EMR first environments, Epic first? Tell me a little bit about that.
I think the most obvious one is rehab medicine. The reason why, because you can make videos of the patients also with your mobile device. So it's not just screen captures. You can use your mobile to make a video. So if patients in rehab and doing physical therapy, occupational therapy, speech therapy, you can keep recordings of these things, and the patients see themselves improve. They can look back at how they were a week ago, and although the therapists can also look at these things for themselves. That's a huge benefit. There's no way to do that with a regular EMR, just as far as phenotype goes. So we've had really good success in rehab. I see value in pretty much everything surgical and cancer. Anything that's film heavy, imaging heavy. There's so much value to sort of normalizing and the imaging and highlight really and putting it in the patient's hands. They know what's going on. They can play it for their loved ones, their family, their friends, and they don't have to, what the doctors say, to just play it back. It's really a workflow issue at the point of care, though. It's people learning how to use the app and not having time.
Yeah.
The people that do are really satisfied with it and really happy. But, and the trouble is there's no incentive. If you created an incentive for this and said, if you make 10 videos for patients this year, you'll get a bonus, or which seems to me to make sense, then why wouldn't hospitals want? But, it's just, it's kind of cart before horse with this. And, unfortunately, the CEOs, these systems aren't that. They're not looking to help us, and so they're not dying to make. And I think they're also very concerned about creating incentives for physicians that not everyone's comfortable with. Not every doctor is comfortable with some of the stuff and recording their voice, or and people are afraid medical legally, and all the other issues that people bring up. So those are the reasons why. But I think that the most benefit would be to hospitals would be in the money-making fields, cancer, neurosciences, neurosurgery, orthopedics,
So,
and cardiac, cardiovascular, because we use imaging and we use complex solutions to problems when people are really at risk, and often there's a lot of emotion, especially with cancer, that just don't remember what the doctor said, and also it's a great way for different disparate people and care groups to see what the other physicians are thinking and seeing, so they don't have to go search PACS and look at the same images and what was he thinking. So a lot of times I can send a video to a colleague and they immediately get what I'm thinking about, and it's a great way to share information. It's just not what people are used to, and so it's just we're way ahead of our time, I think.
yeah. So what you're saying is it has applicability not just from physician to patient, but also like physician to other physician. Like you can use this as a medium, with your other colleague.
Physician to myself, and I've been seeing a patient a month. I turn my video on to remind myself what I said to them. I can immediately see their films, what I told them, and sometimes they'll say, "I didn't remember. You didn't tell me that." Yeah, I did. Here's the video. And they're like,
Yeah.
a video is fantastic. I mean, I have no reluctance to record myself. I'm not saying anything.
Yeah.
Medical legally, I think you're much better having this than not having anything.
Right.
They never remember everything you said, so you didn't say it. By definition, it becomes he said, she said. If I leave something out, that's okay.
Right.
If I say something that I was wrong about, that's okay. The conversation is being had. I'm recording it, and I think that's really, really valuable.
Right. Yeah. No. Absolutely. I mean, and two, like in terms of like adoption here, like I think there's always, I don't know if the word is fear, but at these health systems and that have a huge reliance on EMRs, like your Epic, your Oracle Cerner's of the world, they don't want to have to like log into like another portal or platform to do this, like.
Correct. Yeah, we integrate with Epic. We've been struggling with getting Epic integrations because Epic's in bed with a Bridge, which is one of the big competitors. A Bridge is the biggest ambient company besides Nuance, which is a Microsoft company. Both of those companies have very close relations with Epic. Bridge in particular, I believe, has a revenue agreement with Epic. And so they are the preferred Epic ambient company. And they're a great company. Their technology is fantastic. I think their leadership is very good. I really respect what they've done. And, we're a little different because we have the patient-facing side. But in the end, the Epic environment can be difficult. I mean, it's going to limit your creativity. It's going to limit, your ability to improve your app because you're kind of within this Epic environment. But, 40% of the largest healthcare systems are on Epic, and that's unlikely to, it may get incrementally larger, but it's, because of the cost of change, you're still going to have a big chunk of the market that's not Epic. And that doesn't mean it's easy. I think all in all, you'd rather be on the Epic side because these are the healthcare systems, the deepest pockets, and often are the most creative and the most competitive. But, we're also, there's still a role for ambient, some of the stuff in these other markets, and it's not that expensive. We're able to deliver a product that's at a fraction of the cost of some of our competitors. That's, I'd say does 90% of what theirs does, and also has the patient-facing side, which they can't do. So, why we're poised for success, and I think that it's a matter of finding the market fit, because I think there's room for a lot of different vendors here, and there should be. I mean, it's got to be a competitive market for it to work, and but Epic does change that dynamic. I don't know if you know the Acquired podcast, since you're a podcaster. It's which is a fantastic. These two guys are just great to do the deep dives into companies. The Epic one, they did one on Epic Systems, which is
That's a lot more
remarkable. Yeah. And I learned a lot from listening to it. I've been out to visit Epic. I've met Judy Faulkner. While you can gnash your teeth about them, I think that they're a great company. I do. I think that I think they're operating with the right intent. And just because they're successful doesn't mean we should be against Epic. And that they did what the government asked them to do, and we needed it. Is it perfect? No. I think the other thing that's going to happen, though, with this whole UI UX thing, which is really problematic with the EMRs because they're just so complicated, and it's going to go off the microphone soon anyway. So all this training on using the tool, ultimately it's all going to be voice activated and it's tell you what you want it to do. And I think that's in the offing, especially now when we have these ambient technologies that are baked in. That's inevitable. And so I think that some of the gripes on the interface will just vanish when the screen is white and you have a mic. And so I'm amazed at what they've done. They've taken a very, very complicated problem and put it under one roof. They've been easily the market leader for a variety of reasons. And I think that all other healthcare IT companies are, in awe of that giant monster. But things will change. And I think, frankly, this ambient space and mobility and the patient controlling a lot of their data or wanting to control that, it may flip this a little bit. And I think in the end, the ambient and AI world gives us fresh opportunities to challenge the status quo.
Right. Yeah, that's well said. I was about to ask you, like, where do you see this going next? Like the whole ambient AI, like video based, like patient communication and with other providers. And I love hearing from your perspective that you think everything will be going down the voice activated route, because there are so many physicians and their team, right? You mentioned residents earlier that still heavily rely on, basically like analog input, like inputting into different screens, while they're with the patient, and to hear from you that, hey, we are going to go down this path of everything being voice activated is quite telling,
It's going to happen fast. I mean, I remember if you've ever seen 2001 Space Odyssey with HAL, this was predicted, in the 1960s, and here we are. And what's amazing is how fast things are happening. I think just because all this stuff is open source and so available, we're using tools. I mean, LM Notebook or some of the video AI stuff, or just basic, ambient or chat, and using all these different LLMs to answer questions. I mean, physicians are faced with an array of opportunities to take advantage of not only the way they educate the patient, but educate themselves. And there's no question this is going to have enormous impact on the healthcare space. It's going to very rapidly disrupt the data analysis. It's going to disrupt this whole physician shortage thing. You're going to be able to do a lot more in less time. It's breathtaking, and it's super exciting. I mean, there's not a day that goes by that I'll find something else to play with and start thinking about how that might affect the patient space. And I'm obviously firmly focused on patient-facing stuff. I find the other stuff not as interesting. The ambient notes is so great, but it's just you're replacing what we used to do by typing or or dictating,
right,
which saves us so much time. But it's still the same. It's still creating a medical record. It's been revolutionary, and I would never go back. And it's been a fantastic part of my new medical life because I don't have to write notes anymore. But it's not changing the inherent deliverable. It's just creating a different way of creating it.
Right.
On the other hand, this forward-facing stuff to the patient with AI and with agentic AI, with and the ability for patients to get incredibly accurate information without even talking to a human.
Right.
That's gonna happen, and to me, that is just insanely cool. And we're at Playback. We're deeply looking at the ways to incorporate this into our platform. And I do think that those sort of next generation tools are what are going to be very attractive to healthcare executives, because they're going to see obvious cost savings in the way. I mean, Northwell, for example, has these massive call centers, and they're terrible. Our patients are still calling for appointments and asking nurses questions that the nurses have to call them back and leaving messages, or even the intake, when they come in, they're still filling out an H&P. It's insane. Yeah. This is all going to be done with the ambient, and it's going to happen really quickly. And so that's all part of this patient-facing IT. And then once you start moving that direction, I think this video, audio stuff, and the next level become even more easy to create for the patient.
Yeah, well said. I'm so glad you brought up the agentic AI, because I was going to ask you, at what point does AI understand your voice communication style, and it's no longer Dr. David Langer having to record something. It's you giving an input of hey, remember that video I did with this patient 6 months ago? I need to send another similar one to this patient. Can you help me with that? So it's now it's able to produce that with your own voice and tonality and all that stuff. It's the point where to the patient, it sounds exactly like Dr. Langer would communicating to them. It's
of course not. You look at the early movers in the search space and on the internet. The fetches. I don't know if you remember. You're probably too young to remember that. Those fetch was pre-Google, and there were all these. And so the early companies went away. Yahoo, there are these. So I think, the questions are if you're first to market, is that good or bad in this new age we're embarking upon? This is bigger to me than the internet for healthcare. I mean, the internet in some ways was a great thing for healthcare, but it was kind of information that was diffuse and, poorly organized and, not really edited. And I think it was in many ways as confusing to patients as possible. But this is so disruptive. What's happening? This is just like it's artificial intelligence.
Yeah.
And it's intelligent. It really is. And I am amazed at the accuracy. We don't see the confabulation we were seeing, particularly in some areas where you're have more focused up. You're loading smaller amounts of information. It's keying off, less text, and so it probably doesn't have the opportunity to like pull in crazy stuff.
Yeah.
And the accuracy is amazing. And so
Yeah.
I am just blown away by what I love talking about it. I've talked to our executives.
Yeah.
I also think there are not that many, clinicians out there. There are some really expert AI people, and there are lots of clinicians, but there aren't yet that many people who are pushing this envelope. It's just hard to do because you're waiting for the tool to come. So all you're doing is you're mashing stuff up and learning how to use it in your office practice. And, a lot of people just don't have the time. So
Right.
It's going to be interesting to see how it all. So that's why my bias is that Epic's just going to eat us all alive. They own all the data, and they're going to do this, and they'll come up with some way to do it within the app, and that'll be it. That's what we'll use the rest of our lives.
Well, we still need the early adopters like you that, not just like are enablers of the tech, but also help bring others on board, So that's important. And
Yeah,
Yeah.
like I said, I've always been that way, and I was early to use a lot of things, and then all of a sudden, it just you get blown away. It's not. I'm going to continue to do it, but I'm a little smarter now to know that I really adopted video and healthcare, and I know it works. And
yeah.
someone else, even though we've been doing this, I mean, hopefully it'll be us, but you just never know. And
Yeah.
I think that AI has become so big so fast. It's unclear who the winners are. We know who the losers are going to be, but chances are because Epic is so data intensive, and not only they have the data, they own the data.
Mhm.
So there's no question that they'll, especially with like clinical decision analysis and some of the back end AI for care. Like AI can do all sorts of things with planning in the hospital, OR scheduling, surge planning, bed management, and all the things that humans don't do as well because they can't filter that's all like the administrative and the kind of operational side. But on the care side, the clinical decision support for ERs, for example, when you come in, I mean, you present with a certain chief complaint, and there are very common things that are missed all the time by ER physicians. There was something in the New England Journal that if you gave diagnostic tests to physicians alone, there's with chat and ChatGPT alone, and ChatGPT was 90% effective, and the best physician did with or without ChatGPT was like 75%, because some doctors don't even know how to use ChatGPT, and then they don't trust it. And so the bottom line is it's like a self-driving car is way safer than you. It's just you don't believe it yet. And I think that this is here, and it's a question of which hospitals are going to go for it. And I think the ones that adopt early and often are going to be the leaders, and they're going to have to take, some risk. But it's the risk, it's the road not taken, I think, where the greatest risk is. And I also think that a lot of the leaders in our healthcare organizations aren't subject matter experts, and they very often operate from a series of out of fear, and their budgets are tight, and they don't want to be blamed if it fails. And so they're not the most creative people usually. And so the organizations that are able to, I think, get creative, innovative people and leaders in positions of power are the ones that are going to be successful.
Yeah. Again, well said. Yeah. I mean, it's almost like we're kind of rounding the quarter on like early adoption. We're in this trust phase of like, let's build trust, who emerges, and then we get to a point where there is mass adoption. And this scales to like, I would argue all levels of healthcare, right? Not just your 40% of health systems that are the largest ones that are on Epic, right? Like this goes down to the level of your your dentist offices, your single, providers, your private practices that are still out there, right? Like I know,
Yeah,
yeah, like
agreed.
we brought a company on the podcast not too long ago that is doing that, like ambient AI in the dental space. So that, there are pockets to deliver this sort of value that aren't, like we need them in the biggest health systems. Those have the highest, patient volumes and where most of the patients go and cycle in and out of. But there's pockets of this at many different levels of the system, I would say.
Yeah, well, the trouble is, since everyone wants the enterprise sale,
Yeah.
and that's hard. It's hard to sell into the private practice doctors because the effort to sell is at the in these large enterprise health systems, it's really difficult and rocky because you're dealing with CTOs and CMOs and CMIOs, and you're
Yeah.
not really selling to the doctor. Whereas on the other hand, but once you break through, you get some huge contract to feed 5,000 docs. Whereas if you go on the direct to customer, direct to doctor, it's 1-to-1 almost, and or you go to large system practice groups, there's still 500,000 doctors. They're not going to be large enterprise sales, and so you have to, obviously it's inherently different the way you sell in those environments, and they're more human intensive, and so we have to work on better UI UX and better ways to create a deliverable that's easier to understand and use so that it's super easy to sell.
Yeah.
And then we'll be okay. But, you don't need to teach people to use Instagram. So, I mean, I think that these things ought to be as easy as use as that. We'll be okay.
Right.
The biggest problem is integration. The doctors are used to integrated solutions. If you have your app and it doesn't automatically load the patient and their medical record number and their birth date, there's no, on their cell phone for that matter, there's no good way of organizing this thing. And so that is a huge point of friction and outside the enterprise. So when you're selling to individuals, they're not an integrated solution, they're not going to use it. It's too much. And
Right.
if they're an integrated solution, and if you integrate, there's a cost of integration, which is enormous.
Right.
So
Right.
so that's really the rub. And so we're looking at ways to do this differently at Playback because obviously if you can give the practitioner at least a structure of recording and reliable database that they can search things, even if it's not fully integrated in their healthcare system, especially if they're like a voluntary or external, you're probably okay. But it's just it can't be any friction. How do you do that? And so we're trying to engineer some of these ideas and test them to go after these sorts of environments in that way.
Yeah, that's the whole notion of, have you heard of reference AI, like being able to like reference data for clinicians at a fly, like based on all like
Yeah.
their, clinical data, their notes data, all that, like, and creating like a reference sort of library.
I always thought the best medical record number would be your cell phone because everybody keeps your cell phone forever. No one gets rid of their cell phone.
Yeah.
So if you can link your birth date to your cell phone, you have a great form of medical record.
Yeah.
Why should hospitals create new medical record numbers if you're going to use that? And one of the problems is that we learned the hard way that only about 60% to 70% of cell phone numbers are accurate and that they're given for patients because people register with their loved one's phone number or their caregiver, or they use their own phone, although we're seeing much fewer home phones over the years. But the cell phone's just an amazing way to register people because it immediately gives you not only it's like a functional medical record number that you can contact people through.
Right.
So we kind of use that mantra at Playback, and it really works because it totally allows it's sort of a pseudo integration. You can create a deliverable through a text to a phone without them even having the app. So we can send them content to their text and they can just download the content without them having to download a separate app because nobody wants to have an app they use once. And so that's the kind of the magic. But with healthcare, you only use it when you need it, and it's not like you're using it every day. And so suddenly when you have a problem, no one's up to speed on what the best solution is for this stuff. And then no one, unless the healthcare company is delivering it, it's hard to figure it out. And again, you're going back to EMR vendors or the digital front door. So it's how you solve this remains to be seen.
Yeah. Yeah. And on that point, on solving it, what is next for the team and you and the team at Playback Health, and how do like interested partners or even providers listening can get involved with you and your team?
Well, first of all, you can download our app free. Playback Health Pro is free just to sample it. It's fantastic. It's not integrated, so you have to sort of type the patient's name in afterwards or cut and paste it into your medical record. But it allows you to create templates of different types of notes if you're on a discharge summary or a SOAP note, a subjective objective assessment plan note, or the different types of APIs that will create different note formats, which is great. You use it for business summary, like kind of like a Copilot does, and it also codes your note based on either complexity or length, and gives you a coding recommendation. I would argue that's the best way to get into the business and see if it makes sense for you. Some people don't like it. They don't like the syntax, particularly people who are really making notes for other people to read other than themselves, or lawyers. Us proceduralists, we basically, the only people who read our notes are me, my nurse, maybe a resident pre-op, and then the lawyer who I get sued by. That the notes not being read. I read it because I'll read my plan, or the night before surgery, what did I say? But they're not being written for the purposes of a consultant. Whereas if you're a medical doctor, not only do this is the way we share information with each other, but their egos and their kind of sense of professionalism is tied up in the way the note sounds and their syntax. And so these notes don't sound like you. And they, especially the older folks, I mean, when I say older, people in their 50s and 60s, they're kind of been in this business for long enough that they may not want to change. And there's ways around that by, train the LLM on your own notes, and then eventually it sounds more and more like you. We're planning on creating something like that. But the truth is the next generation is not going to care, because it's going to be so much easier to do it, and your syntax will be out the window, kind of like people are using chat to write their papers and their academic papers. Nobody seems to have a problem with that. So I think this is an inevitability. So we're, firmly in the space of making the notes more bespoke to the practitioner. I think coding and the integration of coding is a big deal. It it shortens revenue cycle. It's another way that hospitals make money, by getting these things coded more quickly, more accurately. I think that obviously the shift to giving things to patients is a big part of our future, whether it's the note itself or a summary of the note that could be, it could be very unique. And so I think there's the opportunities are endless. And I think incorporation of other technologies out there, Google LM Notebook's an amazing technology that we're playing with. So I think that it's just the beginning. This stuff's only really been around for like a year and a half.
That's great.
And it's just unbelievable compared to the prior 15 years. We didn't see what we're seeing.
Yeah.
Maybe 30 years. I mean, the only tech I've seen that was minimally disruptive was Teams or Zoom. That was forced by COVID. But before that, we were basically an Office. Office is the biggest IT company. Microsoft, the biggest IT company never heard of. I mean, everybody has Office, and that's really it. I mean, we're an email, packed world up until March of 23, and the whole thing's blown up by COVID, by telehealth, by Zoom, by screen sharing and virtual, and now AI. And it's having its impact now, and it's never going back.
Yep. Yeah, definitely. I mean, we're in a very interesting juncture, or like inflection point, and like I said, and like both of us are saying, like there is a lot of room to continue innovating and supporting not just the provider, but you as the provider with your patients. And I will definitely be keeping tabs on your guys' journey at Playback Health, and we need more clinicians like yourself that are, being the inside champion voice within the healthcare system to say, hey guys, let's rally behind this. This works, like I've been doing this for so many years now, and we need more advocates like yourself. So appreciate you in that regard, and we'll appreciate the work you're leading at Playback.
We're having an awful lot of fun. I think what's so ironic, I remember the ATM when that came out, or things like Waze, or you forget what it was like to go to a teller to get cash, or have a map to, when you're driving somewhere. I think 25 years from now, this is going to be the way we do this stuff, and it won't be so exciting anymore. But I really feel blessed and lucky to have this, to be part of this right now. Because we're aware of the time savings. I know how much effort I used to put in to write a note or spend time. It takes away from the patient. Now I can just talk to the patient. My voice is being recorded. It's like mind blowing. But the next generation, they're gonna be, that's the way you do it, and what's so big deal about that? And that's the beauty of technology. And I think it keeps me young. It keeps me thinking. It keeps me energized. And, and also as a surgeon, it's nice to have this whole other aspect of my brain that I can be involved with. And I have great partners. Greg Odlin, my co-founder, and the whole
Yep.
Playback team are just wonderful people. And it's been a wonderful addition to my career. I haven't made a dime off of this yet. Probably have lost money just take away from everything else I do, but it's been just fantastic. And
Yeah.
I'm really happy to have been able to spend some time with you to talk about our experience.
Yeah, 100%. And likewise. And it's been a pleasure speaking to you today. And thanks for everything you do, not just for patients, but promoting this technology and building this platform you guys are leading the charge on at Playback. So thanks for all your time today, Dr. Langer. And yeah, we'll be staying in touch, but appreciate your time.
Thanks, Bert.